What's happening, Hardscapers? This is episode 286 of the How to Hardscape podcast, where we talk about how you can start and grow your hardscaping business. And on today's episode, I thought I'd kick off 2025 with a little bit of health and safety. Back in early 2020, when we were just first starting this podcast, we had a health week. And on that week, we published 3 episodes, one including Dr. Marshall Chasin on hearing protection, Dr. Allison Arthur on protecting your skin, a dermatologist, and Jason Anderson, owner of Trillium Maintenance Inc., who is very open about mental health in our industry, and an excellent episode. And I wanted to put these episodes back out there, as well as work on getting more health and safety episodes on the podcast. Within our headquarters software, the How to Hardscape Headquarters software, we have a course content area. We publish our courses, so we've got like installation courses, interlocking concrete pavement, segmental retaining walls, gas fire features, lighting. We've also got a few courses on more financial aspects side of things, including budgeting, estimating, and knowing your numbers, which includes Cycle CPA coming in for a couple of hours and going through a profit and loss statement as well as a balance sheet. And these are great courses, especially for business owners, but also those installation courses to assign to your employees through the software. You can monitor their progress. They get a certificate of completion by the end of it, but also you're able to create courses within your own account. And one thing that you can do with those courses is create safety courses and have your employees go through them once a year. And that way you have documentation that your employee completed that safety course. So you could use, say, this YouTube episode or each individual YouTube episode that we put in here, whether it's hearing safety, dermatology, and mental health here, or any resource that you can find, and create a course around that specific topic and assign it to your employees so that they have to go through that. That way you have documentation that they've gone through this and they know how to, say, operate a demo saw. And we are putting together a list of a bunch of different YouTube videos that we found and I've created courses on for my own company, for my employees to go through, especially coming into the spring, what I plan to do. And excavator, there's great excavator safety training videos. When I first started the software, I wanted to start to get into more of that side of things and creating our own courses. I think we still will in the future, but I dialed that back because there's already a lot of free safety training videos out there on YouTube, and they are excellent. So I dialed that back a bit to put money elsewhere within the software and on development side of things. But within the How to Hardscape Headquarters software, like I said, create your own course, embed whatever videos you want on there, add text, and create different modules and lessons, assign it to your employees, and then they get a certificate of completion at the end with your company logo in the background. And it's just a great way to show, hey, they've done the safety training course. They may be ready for in-field practice on the demo saw or the piece of equipment, or it just once a year, sit down, do these safety training courses that I've assigned to you. Great documentation for your company and for your business. And I wanted to revisit that on this podcast, like I said, and working on getting more. We might do another health and safety week this year for the podcast as well. But before we get into today's episode, we want to say thank you to our sponsor, Cycle CPA. And if you're looking for bookkeeping, accounting, CFO services, reach out to Cycle CPA at cyclecpa.com. Let them know How to Hardscape sent you for money off their services there. And once again, if the How to Hardscape Headquarters software interests you with budgeting, estimating, job costing, time tracking, scheduling, the courses that I just talked about there, and creating your own courses within your business for documentation purposes, reach out to me at How to Hardscape on Instagram, or send me an email, or go to hthheadquarters.com. That's the easiest way. We have a demo right there that you can watch, and you can book a demo with me specifically. So that's hthheadquarters.com. And without further ado, let's get into today's episode. This is Dr. Marshall Chasin on hearing safety. Today we're joined on the podcast by Dr. Marshall Chasin, Doctor of Audiology, Director of Research at the Musicians Clinics of Canada, and he's here to talk to us about hearing loss and protecting your hearing on the job site. Dr. Marshall Chasin, thank you so much for joining us on the show.
Oh, it's my pleasure.
Let's just get started to get to know a little bit more about yourself and what you do. Can you give our audience a little bit of a rundown about your background?
I am a clinical and research audiologist, and I run the Musicians Clinics of Canada. I also do a fair amount of research and teaching at various universities, the University of Toronto, the University of Western Ontario, and I'm a research associate at the University of Buffalo, in Buffalo. I've written about 8 books, edited a few more, and have written over 200 research articles in the literature. I do see a lot of musicians, but I see a wide range of people, ranging from young children to the elderly who may have some hearing loss. In the case of young children, of course, it's usually temporary ear infection, wax in the ears, that sort of stuff. In the case of more senior people, it tends to be either age-related or noise-related, whether the noise is music or factory noise, the ear, in its infinite wisdom, doesn't really know the difference.
Now, it's safe to say that you are the person that we want on the show talking about this subject today. Let's just talk a little bit more about what brought you to this sort of field.
Well, my background's actually mathematics. I was going to be one of these nerdy Einstein. I even looked like Einstein back then with my hair, but now it's pretty balding. But I wanted to be a nerdy mathematician and do research in math and teach math at a university. After many years, I realized that's kind of boring. And I was very interested in communication systems. Now, a mathematician or a physicist would talk about formal algebras or communication systems, but I actually wanted to learn about real communication systems. So I ended up doing a master's of linguistics, which is the formal study of languages. And after math, that was a little bit too artsy, too undefined for my liking. So my graduate advisor said, had you ever heard of audiology? And I'd never heard of an audiologist. I was in my mid-20s at the time. And but I went to the University of British Columbia and did another master's in audiology. And actually, it's a fascinating field. It's a nice combination between science, clinical, and research. It's a nice balance between many things. And since I like people, it allows me to get in front of a person rather than in front of a computer.
Let's get right into this and start with asking you, why is protecting our hearing so important, especially in our industry where we're cutting concrete and operating heavy machinery? Why is it so important to protect our hearing?
Hearing loss is sometimes called the invisible handicap, in the sense that if you damage your ears, blood doesn't gush out of your head. In some sense, life would be so much easier if that were the case. You'd know that you've cut your finger, it's bleeding, you've had a fracture in a bone, and you can feel it, you see it. But with hearing loss, you might have ringing after a shift or a day, maybe a feeling of fullness in the ears, but there's nothing obvious. It's quite invisible. And also, it's incredibly startling how quiet noise can be, or music for that matter, that if you listen to it long enough, it can damage your hearing permanently. For example, a dial tone on a telephone. Nobody would think in their right mind that was particularly loud, and it's not all that loud, but it is intense enough such that if you listen to that long enough, it would cause hearing loss. Listening to your MP3 player on half volume can far exceed 85 decibels. 85 decibels appears to be a measure of how loud something is that can cause some hearing loss. Right now, you're probably listening to me at 65 or 70 decibels. But anything over 85 can cause hearing loss. Dial tone was one example. iPod maybe in half volume. If you're not feeling very well and you put your head in the toilet, you flush the toilet, that's also 85 decibels. You may not be feeling very well at that point, and it may sound louder, but nobody in their right mind would consider a potentially damaging level of noise or music to be damaging. It's just counterintuitive. So prevention is where it's at. I don't want to see people after 35 years working in industry and I'm saying, I'm sorry, there's nothing that we could do. You have a permanent hearing loss. But they would say, well, it wasn't all that loud. And they're probably right. It wasn't all that loud, but it was intense enough to cause hearing loss.
Now, when you're talking about intensity, you talked about decibels there. Can you give our audience a little definition of what decibels are? And then also, does frequency play a factor in hearing loss as well, not just decibels? Or does that play a factor in, say, a construction field?
Well, next time you go to a party or a family gathering, say 10 times the logarithm of the sound level over 0.0002 dB per square centimeter. And they're going to say, wow, you really know what you're talking about. But that's the formal definition of a decibel. The more practical definition of a decibel, think of it like this, like a scale, Fahrenheit or a Celsius scale, depending on where you're listening. The higher the level is, and each decibel is the same degree, just like temperature. And it gets to a certain point where it can be problematic. And we have meters or decibel meters called sound level meters. You can buy them commercially. They can be thousands of dollars or even $100, or you can have an app on your phone. Many smartphones now, you can download a sound level meter, and it will give you a number, and that number is a decibel. And it's a special type of decibels. Not all decibels are the same, just like Celsius is not the same as Fahrenheit. So Fahrenheit would be in the United States. Celsius has the rest of the world talking about it. If I say it's 30 degrees, you don't really know whether you have to wear a jacket and gloves or short sleeves and a sun hat. But you have to define the type of temperature. So 30 degrees Celsius would be hot. 30 degrees Fahrenheit would be cold. Same with decibel. We have something called the decibel A weighted, the letter A, first letter of the alphabet. And that happens to be a type of a decibel that correlates very highly with how the human hearing system works. And actually, the way the human hearing system works is kind of neat. All the stuff on the left-hand side of the piano keyboard, the bass notes, it takes a lot of that before you could even hear it. That is, the stuff on the left-hand side of the piano keyboard, much of that hits the ear, bounces back out, off the ear, and never is heard by the individual. And this is how we hear as humans. This is normal hearing. And so we have a scale that rejects much of the left-hand side of the piano keyboard to simulate what the human ear would be like, and that's the decibel dBA weighted or dBA measurement. So on your sound app or your smartphone, you want to select dBA weighted, and those numbers give you a good indication. So at a dBA weighted, right now, I would be speaking to you at about 50 to 55, maybe 60 decibels. And it's a telephone dial tone that's around 85 decibels. So we know that prolonged exposure to anything over 85 decibels can cause hearing loss. 85 decibels for 40 hours a week. Well, nobody listens to noise or music for 40 hours a week. We take time off. It's intermittent. We take breaks. We go for lunch. Yes, there's a drill going on, but the drill's on for 7 seconds before it's turned off. But there's a relationship. 85 decibels A-weighted for 40 hours a week is the very same as 88 decibels for only 20 hours a week. Slightly higher, 3 decibels higher for only half the exposure. 91 for 10 hours a week, 94 decibels A-weighted for only 5 hours a week, and so on. Now, we can be exposed for 3 or 4 hours here and there at 97 or 98 decibels, but that's the very same thing for working your 40-hour work week at 85 decibels. Now, we're not expected to memorize all these numbers. In fact, there's something called a dosimeter, and it measures what we call the dose. And the dose is 100% if you've been exposed to 85 decibels for 40 hours a week. It's also 100% dose if you've been exposed to 97 decibels A-weighted for only 2 or 3 hours a week. And so it does the calculations for you without you having to think about it. If you happen to have an iOS Apple platform, a smartphone, then you can download a number of free dose apps. One of them is called SoundLog, one word, SOUNDLOG, and that you turn on, and when you turn it off, it says you've been exposed 72% of your dose, which is good. Or if it's over 100%, it said you are only allowed to be exposed for 12 minutes without hearing protection. I went to a concert recently. I turned it on on at the beginning of the concert and turned it off near the end. And indeed, it said I was only allowed to be exposed for 12 minutes. Well, the concert was 2 to 3 hours long. It's a good thing I brought my hearing protection. Now, the music sounded great. It didn't sound all that loud, but it was loud. And as humans, we are wonderful at discerning differences in frequency. We know something is pitch sharp or pitched flat, something is flat or sharp. We can tell that. But in terms of loudness, we are not good creatures. Listen to 85 decibels, people expect to say, well, this is a potentially damaging area, and they brace themselves, and only to hear a dial tone. So we're not very good at discerning levels of loudness. But with these sound level meters to actually measure the decibels A-weighted, or these dose meters or dosimeters, such as Sound Log in the United States, the NIOSH, which is the National Institute for Occupational Safety and Health, NIOSH. They also have an app, a free app that can give you the dose. So it's really the dose that we care about. Nothing wrong with having a very long or loud shift at work. Just maybe don't mow your lawn that night. Get someone else to do it for you, or wait until the next morning. So you don't want to exceed the dose, 100% dose.
That's fascinating. Definitely interesting stuff that you just mentioned there, including all the resources that you mentioned would definitely help on any job site to understand the dosage that you got into there. Now, what about the effects, the negative effects of hearing loss? What kind of effects should we expect over time, and are those effects reversible?
When we first go to a loud venue, whether it's a construction site or work factory or a rock concert for that matter, for the first, if I was to measure your hearing just before the concert or just before your work shift began, and then measured your hearing immediately after the concert or after the work shift ended, I would measure a temporary hearing loss. And we call that a TTS, or temporary threshold shift. In fact, I have developed an app called Temporary Hearing Loss Test. And this is a measure that you can measure on your smartphone, Android or iOS, and you measure your hearing just before and again after, and it calculates the difference. This difference is a measure of temporary threshold shift or temporary hearing loss. Now, after 16 to 18 hours, this temporary hearing loss will slowly resolve, will get better on its own. You may have a feeling of fullness in the ears. Maybe you have your radio in your car adjusted to a comfortable listening level when you came to work, but when you started your car after the end of the day, the radio seemed kind of muffled and quiet. That is another indicator that you have a temporary hearing loss. Enough of this temporary threshold shift, however, and it does become permanent. We don't really know the relationship between a temporary hearing loss and an eventual permanent one. People have looked at this and tried to research this, and we're not too sure of the relationship. That is, two people working in a factory side by side on an assembly line, for example, for 35 years. One person suffers significant temporary threshold shift after every shift. The other person has never noticed that. 30 years later, that's not an indication. The person that has suffered the time of temporary threshold shift is not more nor less susceptible to permanent hearing loss down the line. So we don't really know the relationship between that. However, once it is permanent, as the name suggests, it is permanent. Interestingly enough, people won't recognize it as a hearing loss per se, because it usually occurs only on the right-hand side of the piano keyboard where the tinkly notes are. And that's in speech where the consonants are, the S's, the SH's, the TH's. In English, and in fact in most languages around the world, perhaps with the exception of Japanese, interesting language into itself, but most languages, that's where all the clarity, the understanding comes from. So a person might say, oh, I can hear you fine, you're just mumbling. So they will notice it by the fact that it's loud enough, but it's people mumble. And usually it's family and friends that would notice it before you. You probably will slowly withdraw from social situations without even realizing it, or you may answer inappropriately or to a different question from what you thought, and your family members, your friends would look at each other and say, what's happening here? That's not what we're talking about. So hearing loss is very slow. It's very gradual. It takes years and years and years. Usually there's no obvious indication. You'll still hear okay, but you're mumbling. There may be some ringing or tinnitus in your ears, kind of a hum perhaps, or a whistle perhaps. And this ringing can be very annoying sometimes. It can keep you awake, interrupt your sleep habits. If you happen to be a musician, it will certainly decrease your enjoyment of the music. There may be, but there won't be any pain associated with it. If there is any pain in your ears, it's not because of loud noise or loud music. You may have something like an ear infection or earwax impaction, something that you should see your audiologist or your family doctor about.
Gotcha. Now, over the years, working in this industry, as well as once having my eardrum rupture, I definitely have that ringing in my left ear, and I definitely notice it, especially in quieter times and in trying to go to sleep. So with all this, with maybe some damage already caused, or maybe you're just starting in the industry, how can we protect our hearing from these negative effects?
There's a wide range of hearing protectors that are available. I think that many people in a construction site, they wear either the foam earplugs that go into the ears or ear muffs that go over the head. And those are important to wear because you want to minimize the amount of sound waves that hit the ear and thereby cause some permanent damage. Many people don't like hearing protection, and I hear that. I understand that. For one thing, that you have hearing earplugs in the ears, even if you're in a quieter place, you'll say, oh, you're all muffled. I don't understand what you're saying. And many factory workers remove the earplugs from the ear just so that they can listen to their friend or the music that maybe that's playing in the venue. But in doing so, they've removed the hearing protection. So it's important to wear the hearing protection and to wear it properly. Many people tend to take off their earmuffs, put it onto the lunchbox or some other structure to expand them or stretch the spring around the head so it doesn't press as tightly into the head. Well, that minimizes or undoes the benefit of a hearing protector. So that's one of the advantages of an earphone that goes over the earhead, that you can play with it and fake it. But the benefit of that type is that it does give you more overall hearing protection. So you should just get used to having something on your ears. Many people that use foam plugs, it's true, nothing goes over your head, and it might be more comfortable in the long run. But if you do that, and there's nothing wrong with that, by the way, when you put something in the ear, here's a clinical trick that I always suggest to people, and you can verify this for yourself. Take your finger right now, stick it into your ear. I know, clean finger, presumably. You know where it's been. You stick it into your ear, open and close your mouth, and you'll feel that there's some wiggling going on in the ear. And when you open the mouth, the jaw is dropping forward, and that sits at the front part of the ear canal. And so when you open your mouth, the ear canal temporarily becomes larger, wider from front to back dimension than with not. And so if you open your mouth, put the earplug in your ear, you'll be able to put the earplug in deeper, and such that when you close your mouth and relax, the earplug is better seated in the ear canal and will give you better overall hearing protection. So hearing protection is very, very useful. For those people working in mild level industry, that is industry where the sound level in dBA may be less than 100, over 85, but less than 100 decibels, there is some trickery that we can steal from the music industry. Since 1988, there's a special type of an earplug called the ER15, and these are made by audiologists. And the idea behind them is that it treats all the sounds the same. The number 15, 1-5, means that it can attenuate or lessen the sound by 15 decibels. So if you're in an industry where the sound level is 95 or 98 decibels, which is very common on a construction site, dropping something 15 decibels, you can actually subtract it, will bring you down into the low 80s. Well, that's less than 85 decibels. So sometimes more hearing protection is not necessarily better. And having just 15 decibels with many musicians wear will allow you to wear the ER15. It will be safe, but the interesting thing about these ER15 earplugs is that it treats the bass notes, the mid-range, and the high tinkly notes the same, such that speech still sounds like speech. You'll be able to hear the people around you, just lessened from a damaging to a non-damaging level. Another thing, other than hearing protection, is rest times or intermittency. Again, nothing wrong with going to a rock concert or playing your own guitar if you happen to be a musician yourself, or having a long shift on a construction site. Just don't go home that day and mow your lawn that day. Save it for the next morning or get someone else to do it for you. Try to minimize the other sources of noise or music exposure on your ear. So you come home, you might want to not listen to the radio when you're driving in your car. You may want to just, do something more quieter around the home that night. If your grass does need mowing, wonderful. Go to sleep, wake up next morning, 16 to 18 hours later, and I think the ear can kind of reset itself, and it's safe to cut the grass. Don't cut it before 8 a.m. or else your neighbors will hate you for that. There's also another new area of research that's coming along, and it's called otoprotectants. Oto meaning the ear. Protectants is obvious. You protect your ear. These are pharmaceuticals, pills that you could take. Some cases you can take them before you go to work, and it will lessen the extent of the noise exposure on the ear. And there are some that you can take the morning after. You had a particularly noisy day and your ears are ringing, you go home, and you can take a pill that will mitigate the damage that's in the ear. And some of these otoprotectants are just going through the process of the Food and Drug Administration in the United States, the FDA. Some of them are right now in phase 3. So whenever the government or any country approves a medication or a drug, it has to go through 3 phases. The first one is for safety, to demonstrate that it does what it should do, but at a safe level. The second phase, or phase 2, requirements is that it does what it says it does. So it's not only safe, but it does actually protect you. And the third phase is if they do it on massively large numbers of people and they get all this known side effects. And after about 10 years, the pharmaceutical company will say, I now have a drug that we can take just before you go to work, pop a pill, and it will lessen the effects of noise exposure on your ear.
Excellent information. And just relating this back to recently shopping for noise protection, if the noisiest thing I guess we do on a job site would possibly be cutting concrete, which if I'm shopping for, say, an earplug and I notice that the noise rate reduction is not going to get me down to that safer level of, like you said, 85 decibels, can I also purchase an over-the-ear protection, like an ear muff, that's also going to reduce that rate a little bit more to get closer to that 85? Can I apply both an earbud plus an over-the-ear hearing protection, and that's going to get me to that safe level? Is that something I can assume, or how does that work?
You can indeed use various types of hearing protection concurrently. That is, you can certainly have an earplug in the ear and an ear muff that goes over your ear. And in a couple of years, when otoprotectants are more available, take an otoprotectant medication to protect your ears. They are additive. That is, if the earplug, let's say, gives you 15 or 20 decibels of protection, and the ear muff gives you another 20 or 30 decibels, there is an upper limit. It won't be 50, but it will be up to 40. That is, 40 decibels seems to be the upper limit of any hearing protector. If I went in and traveled concrete into your ear canal and just let it sit there, at most it would give you a 40 decibel hearing protection. And that's because after 40 decibels, the sound would cause the human skull to vibrate, and the sound would actually bypass the outer ear where the earplug would be and go directly to the inner ear, which is where the damage is. So you could certainly add the two. Now, many hearing protectors have a rating associated with them, and this rating does vary from country to to country. In the United States, they use the NRR, or the noise reduction rating. That actually is a very poor single number measure, and there's a lot of problems with that measure. In most cases, the hearing protection actually gives you more real protection than what the NRR states it does. So all I'm saying is that don't be blinded by a number on a package. A hearing protector with an NRR rating of 23 may not in fact be better than one with a 20 decibel NRR rating. This is where maybe an audiologist would come in handy. So an audiologist, a university-trained professional, isn't just a person you go to when you have an ear infection, or let's say you need a hearing aid or whatever, or for counseling with respect to tinnitus, but it's a person that you go to for prevention. And I think hearing loss prevention, whether it's from loud noise or music, is one of the most important things that you could do. You bring your hearing protector to the audiologist. The audiologist has several techniques by which they can measure the real ear lessening or protection or attenuation of the hearing protection on you. Never mind what it does in theory or in a package or some laboratory someplace. But the way you wear it, they can actually measure your hearing without the hearing protectors and then with the hearing protectors. And that difference is a very good indicator of how good the earplugs can be for you. And you could use both of them together when you're cutting concrete or doing something very noisy, or if you're in the military where you're shooting these extremely large and noisy firearms, or cannons. Having an earplug and an earmuff together can be very, very useful.
Fascinating stuff today, and thank you so much for joining us. Is there anything else that we haven't covered in this interview that you'd want somebody on a job site, on a construction site, to know to stay safe with their hearing?
There are three good sources of information on the internet. One is the website of the Canadian Academy of Audiologists. They have a wealth of good hearing loss prevention and tinnitus prevention information, and that can be accessed through canadianaudiology.ca. Also, on that same site, there is another subsite called Find an Audiologist. One word, findanaudiologist.ca, and that will give you the name of a local person that you can go to. If you're not in Canada or the northern United States, usually every state would have their own audiology association with a list of audiologists. Finally, I've just relaunched my Musicians Clinics website, and so it's musicians with an S, clinics with an S.com. Musicians Clinics. And if you go to the publications section, there are a wealth of 25 or 30 different publications written at the lay level. You don't need all the technology and all the terminology about hearing loss prevention. There's also about 35 frequently asked questions, FAQs, all about hearing loss prevention. Now, many of them are aimed at the musician, but they're equally applicable to a construction site.
We want to take a break from today's episode to thank our sponsor, Cycle CPA. It's crucial to review your financial statements on a monthly basis so you can diagnose areas for improving your business's financial health early before they become significant issues. Too many contractors wait until the end of the year to review their financials as they file taxes, when it's often too late to take action to change the outcome. Cycle CPA not only handles bookkeeping and taxes, but they also ensure that you're armed with financial data on a monthly basis to make key business decisions. They offer benchmarking, cash flow forecasting, and assistance in developing targets for financial metrics. With their team of accountants specialized in the hardscape and landscape industry, they currently work with hundreds of companies in this field. Visit cyclecpa.com, and for $200 off, mention the How to Hardscape podcast. Now back to our episode. This is Dr. Allison Arthur, dermatologist on skin health. Today, I'm joined by Dr. Allison Arthur. She is a dermatologist that is here today to talk with us about the health of our skin while working outdoors. Thank you so much for joining me here.
Thank you. I'm glad to be here, Mike.
Dr. Allison, can we just get started by talking a little bit more about yourself, your background in being a dermatologist? Can you give us a little bit of a rundown about yourself?
Yes, I'd be happy to. A dermatologist is a medical doctor who specializes in the health of the skin, hair, and nails. I graduated from the University of Florida for medical school, and I completed all of my dermatology residency and fellowship training at the Mayo Clinic in Rochester, Minnesota. And I now am in private practice in Orlando, Florida. I have a kind of a full service dermatology practice where I treat everything from skin cancer to psoriasis to wrinkles. And one of the things that I love about dermatology is that we not only do medical treatments, but we also perform surgery, and we can look at pathology slides under the microscope. So it's a great field. I love what I do. And I am a member of the American Academy of Dermatology and serve on several committees as well for the Academy. And I'm glad to be here today representing them.
Thank you so much for joining us here and helping us with skincare when it comes to working outdoors, because it's such a prevalent thing for us in our industry. And just getting started here, when you have a patient coming into you, are they generally coming into you because something has happened, or do you have people coming into for preventative measures? Or is it a reactionary thing, or is it a preventative thing that they're coming into you for normally?
Definitely both. So some patients come in just for routine skin cancer screenings, and that's where we look at the patient from head to toe. We check their scalp, we check their ears between the toes and everything in between, and we're just looking for any spots that might be suspicious for skin cancer. Sometimes patients are prompted to do that because they know that they're at high risk for skin cancer. For example, they have a history of tanning bed use. They have had a family member who's had a skin cancer like melanoma, or perhaps they have a job or hobbies where they spend a lot of time outside in the sun. And so that may be something that they just do routinely for preventative health, and also to learn for tips on how to take care of their skin and protect their skin. But then some of my visits are where patients are coming in because they have a specific concern. For example, they noticed a new spot on their skin, or they noticed that they have a mole that's changing.
In terms of protecting our skin, why is it so important, especially for those of us that are working outdoors on an ongoing basis and in the sun and in the elements?
It's important to protect your skin from the sun because exposure to ultraviolet radiation is the most preventable cause of skin cancer and skin aging. So ultraviolet light can actually cause mutations in our cells that can increase your risk for skin cancer down the road. It also causes a lot of age-related changes because the ultraviolet light breaks down collagen and elastic fibers, and collagen is what gives plumpness to our skin. So as we lose that collagen over time and we lose some of the elasticity of our skin, that can produce wrinkles. It also can cause brown spots, skin discoloration. The skin can become more fragile and bruise easily in areas that have had a lot of chronic sun exposure.
When it comes to sun exposure, is this only when the sun is out, when we're working outdoors, or will we experience the same negative effects from these ultraviolet rays when it's cloudy, when you don't see the sun, or maybe even when you're in the truck driving around for the day? Is this going to be protecting us when the clouds are blocking out the sun, or when we're in the truck?
That's a great question. The ultraviolet rays absolutely penetrate through the clouds and also can come through the glass in the truck. And so you really have to be careful all of the time, no matter what the weather looks like. I've seen some of the worst sunburns after cloudy days because patients say that they forgot about their sunscreen, or they didn't realize that they had to keep their skin protected because it wasn't sunny.
Now, these effects, you talked about some of these negative effects when it comes to ultraviolet rays. Now, are these effects, are they reversible when, say, we start to notice them? And in terms of noticing them, what should we be looking for in our skin? Because, I mean, as we get older, we start to see our skin change a little bit here and there. Maybe a mole pops up. How do we know that these effects are happening, that we should see a dermatologist?
Great questions. I'll try to break it down a little bit. So first, we can talk about the age-related skin changes. And so yes, age-related skin changes caused by ultraviolet light can be partially reversible. For example, there are treatments that we can do, such as laser treatments or chemical peels, to try to erase some of the effects of the sun damage and eliminate brown spots, or try to stimulate some new collagen to grow. But certainly, this is a situation where an ounce of prevention is worth a pound of cure. Once a lot of damage has been done, we can never get the skin back to being as healthy as it was, when you were a kid. And so the more that you can do to protect and prevent these changes, the better. With regards to some of the changes that can lead to skin cancer, sometimes patients will notice some precancers develop, and these can be pink spots that have a rough or crusty texture. They tend to come up in areas that get the most sun exposure, such as the forehead, the tops of the ears, and the backs of the hands. And unlike dry skin, they don't tend to get better with moisturizer, and they stay. They don't go away or heal on their own. And so if you're seeing these types of pink rough spots come up that stay around and don't get better with time or with moisturizer, that would be a good thing to see a dermatologist about. Because if we can diagnose and treat some of these spots when they're precancers, we could potentially prevent some skin cancers from developing as time goes on.
Yeah, you talked a bit about an ounce of prevention is worth a pound of cure. So when it comes to this prevention, what can we use to protect our skin from the sun, from these ultraviolet rays?
There are lots of tools that you can use to protect your skin from the sun. A lot of people, when they hear the phrase sun protection, they immediately think of sunscreen. And sunscreen is great, but that's just one thing that you can have to protect your skin. There's actually a lot of different tools, so I'll talk about all of them. The first thing with sunscreen I recommend would be to look for a sunscreen that has a sun protection factor or SPF of 30 or higher. And I prefer sunscreens that have zinc. Zinc is a mineral that gives great coverage against all the ultraviolet A and ultraviolet B rays. So that's what we refer to as a broad spectrum sunscreen. If you sweat a lot, you would also want to choose a sunscreen that says that it's water resistant, which means that it will help to stay in place and won't easily run into your eyes or wipe off the skin easily. It is important to reapply sunscreen every couple of hours. And I find that that's a place where a lot of times people fall short because they put the sunscreen on in the morning and they assume they're protected, but they forget to reapply throughout the day. In addition to sunscreen, I find it really helpful to just cover up as much as possible. So whenever you can wear things like long sleeves, hats, sunglasses, gloves, that makes a really big difference. There are some clothing items that are labeled as ultraviolet protective clothes, and they will sometimes have a tag that says UPF, and that means that fabric was specially designed to protect from the sun. But even just a regular long sleeve t-shirt will offer some sun protection. When you're shopping for a hat, it's good to look for a hat that has a brim all the way around as opposed to a baseball cap, because that way the ears are protected as well. And it's ideal to have a brim that's at least 3.5 inches. And some hats even have a little flap that comes down in the back to cover the neck. Oh, additionally, don't forget a lip balm with sunscreen. A lot of times the lips are neglected, and if skin cancer develops on the lip, they can be aggressive because of the lymphatic drainage from the lower lip. And so there's more of a risk that skin cancer on the lip could spread to the lymph nodes. So it's always important to have a lip balm with sunscreen. HelioCare is something that you might not have heard of before. It is an antioxidant, and it's a pill that's taken by mouth. It doesn't take the place of sunscreen or sun protective clothes, but it's just an extra step that you can take to help protect the skin from free radical damage. So HelioCare comes from a fern that grows in Central and South America, and it has been shown to help decrease the risk of sunburn. So it's a really nice strategy to have, especially for folks who are fair-skinned and might sunburn easily. Finally, whenever you can, if it's possible, to arrange for any indoor activities to be done in the middle of the day, that would be ideal, because right around noon, the ultraviolet rays are at their peak and you'll get the most direct ultraviolet exposure. So if you have any planning activities, administrative work, or things like meeting with clients that could be done indoors, it would be fantastic to do that right in the middle of the day and then do more of the outdoor work early in the morning and later in the afternoon.
Excellent advice in terms of preventative measures. And you're right, the HelioCare, I've never heard of that before. Is that fairly new on the market? And for those more interested in it, you talked about it's derived from a plant. Is it completely natural? Are there any side effects that people might experience from this? And where can people learn more about that if they're interested in it?
HelioCare is completely natural because it's derived from a plant. It is available without a prescription. Here where I live in Orlando, Florida, it can be found at common drugstores. It can also be ordered online. And it's been around for a long time, actually. It's used in many countries. It rarely has side effects. There's a small reported incidence of itching or stomach upset with it, but I personally have never had any side effects, nor have any of my patients who take HelioCare ever reported any side effects from it.
Amazing, and definitely an alternative method to dealing with this skin protection that I would have never thought about myself. And now getting into these effects again that we experience from sun exposure. And these long-term effects, can you give us a little bit of a timeline about, if we don't use any of these preventative measures for sun care, when might we be starting to experience these negative effects that come from this down the road? Like how long would it take for us to experience say a major side effect from sun exposure?
It depends on the individual, and there's a lot of factors that can come into play with regards to when some of the effects of sun exposure might be seen. For example, someone who has a lighter skin type, who sunburns easily with blonde or red hair and blue eyes, might start to see signs of sun damage on the skin even in childhood or the teenage years. And then somebody with darker skin where they have more kind of built-in sun protection, so to speak, might not see those changes until a little bit later in life. Skin cancer can affect all ages, and I have had folks in their 20s with basal and squamous cell carcinomas, which are the types of skin cancer that are thought to be related to chronic sun exposure over time. So we're definitely seeing skin cancers in younger patients, although they're most commonly diagnosed in folks who are in their 50s and older.
And just a great way to know that, it affects everybody, any age. So it's important to use these preventative measures that you've already discussed with us. And thank you so much for all the advice you've given us today. Is there anything else that we haven't covered that you feel would be important to either highlight or explain further to our audience?
Yes, I'd love to give some some tips on things to look for, that would be a red flag and it would indicate that you should go see a dermatologist.
Absolutely.
So some signs of skin cancer would include a sore that doesn't want to heal. Oftentimes patients will come in saying, I thought that this was a pimple, but it hasn't healed. It's been there for a couple of months and it's just not going away. And oftentimes with that history, we may find something concerning. Also, sometimes patients will notice a spot that they've had for a while, but it seems to be changing. So if you have a mole that is changing color, if it's growing in size, or if a mole used to be flat and now it's raised, if it's itching or bleeding for no reason, those are all red flags that mole should be checked by a dermatologist.
This is Chasin Anderson, owner of Trillium Maintenance, Inc. on mental health. Today, we're joined by Chasin Anderson, and he's the owner of Trillium Maintenance, Inc., and he is here today to talk with us about mental health and his story as an entrepreneur. Chasin, thank you so much for joining me here today.
Hey, thanks for having us, Mike.
Chasin, you reached out to us and you talked about mental health and this need for having a discussion on the podcast for mental health. So thanks so much for reaching out to us and prompting this episode that we're going to have in our Health Week podcast that we're doing. But let's get started to get to know a little bit more about yourself, Chasin, and your journey in this industry. Can you give us a little bit of a background on that?
Absolutely, I can. So I started in this industry as I was 15, as most people, pushing a lawnmower, 38 now, well, going on 38, 37, about to get there. And at about the age of 28, I started this company called Trillium Maintenance, Inc. I worked for a fellow, and with him, I was there for 10 years. I became his apprentice. I went to horticulture apprentice school at Humber College, and from there, I fell in love with landscape design, and that propelled me towards the hardscape industry. I'd always kind of dabbled with interlocking steps, retaining walls, doing gardens, but it wasn't until I actually opened this company that I really got hard into it. And from there, just things propelled. You get into home shows, you get into Facebook ads, you get into Instagram, all these avenues, and you start meeting people, talking, and doing some jobs that are really quite spectacular, interesting, and going places that you never really thought you'd go. So that's kind of a little bit about me and where we started.
Absolutely. And what year did you decide to start your company?
That was 2010. So I actually was enrolled in the apprenticeship program at Humber, and I was going to night school for landscape design at the same time. So I started this business doing 67 hours of full-time school plus having a job and then starting a business.
Incredible. So lots of things on your plate during that time, and being a business owner is always a stressful situation at times. And, that brings us to what we're going to get into talking about today. And let's just get started to learn more about your journey as an entrepreneur. Starting with exactly where we left off there, that 67 plus hours of schooling, having a job, and starting your business. What kind of stress did that bring about in your life?
At the time, I didn't really notice the stress. I was more just hustling, right? Head down, got to do what I got to do. Had a beautiful woman beside me. So, everything was good. Everything was on the up and up. It wasn't until about, a year later that I realized, hell, this is a hard gig, right? You don't just show up every day. You don't just take your jacket off at the end of the day. You really got to hustle and hustle and hustle hard to make a difference. And there's a lot of competition. There's a lot of people out there. That's just what it takes, right? So one day, I woke up and I went, holy crap, like I'm actually doing this, but how am I actually doing this? What have I done that actually got me to this point, right? And I didn't really know. I didn't really understand how I had done any of it. All I knew was that I just got to kept going and going and going and going. And I started gaining weight, right? And that affects your health quite a bit. The stress was really packing on the pounds with me, not sleeping correctly, being on the road all the time, eating out, no time to get home and relieve the stress, working Saturdays, Sundays. I did this for years, Mike. And this is a very common practice in our industry to get going, and we think it's a normal thing, right? Kind of puts really a lot of stress on the people around you as well, right? And that beautiful woman that I was with, well, she was no longer there. And I was stuck on my own doing all this, which is fine because that's what we are. We're hustlers. We're going to do it. We're going to do it. We're going to do it. And I just kept saying to that to myself, just keep going. You know, the next step is there. The next step is there. The next step is there. And I created this culture for myself and inside of my company that, you know, we're going to work as much as we can. And I didn't finish my landscape design until my first year of actual entrepreneurship. And I went out and I said, you know what, I got to practice my design. So I started designing for other companies. I designed for a couple big companies in Toronto and a couple small companies out here, plus designing for myself, plus installing for myself, plus also going out and getting work for myself, plus dealing with payroll, taxes, all sorts of things. And I took on every single little thing I could, thinking that was the best way, if you know what I mean. And inside of this, I created this massive stress ball that I couldn't really get out of, right? It wasn't until about 5 years later where I really started to realize this, that my entire life had been engulfed by this company. And I had made it to a certain point financially where now I could step back, right? And now I could bring on different people, different talent. I could share my talent now with my employees and train people better and do this, that, and the other. I had gotten through to that 5-year mark, and that was a really big turning point for me. At that point in time, gosh, Mike, I was about 260 pounds. I'm 5'8", and I should be about 175 pounds, 185 pounds lean, right? So my health was not there, but I kept pushing and pushing and pushing, and the stress built up and all of these things built up. One day I came home and, you know, I'd found my father passed away. All of this stress instantly hit, right? And it developed into an anxiety disorder. There was nothing I could really do about it except for hustle. This was the culture that we all fall victim to, right? Is just hustle, hustle, hustle. So instead of grieving, instead of going through the process, I hustled. I took this anxiety, I pushed it to the side. I took this depression, I pushed it to the side, and I filled it with work. And probably the worst thing I did for myself. I still continued to grow. I still continued to do jobs. About 3 months later, I had a backache. And I said, you know, this doesn't feel like a normal backache. I think I have a hernia. I go to see my doctor, and the doctor says to me, you know, there's just something doesn't look right about you. You're a landscaper, you know, you just don't look right. You shouldn't be this white. You shouldn't be this pale. I said, okay, whatever. Do the test. I got to get back to work type thing. The next day I get called into the emergency room, and I come to find out that I'd been bleeding internally for years on end due to stress, due to what's called a Cameron's ulcer. And these Cameron's ulcers are actually fairly rare, but are associated with stress, anxiety, all sorts of other issues that we go through in life. So I had bled out so much, I had they described it as you're 90% water, 10% gasoline. Your car's not going to run anymore, right? From there, I had to have a life-altering surgery. We don't know what happened, but my stomach actually distended into my chest and was wrapping around my heart. The whole time I had been working, Mike. These people were looking at me and they say, did you actually walk in? I said, yeah, I walked in. Did you actually drive yourself here? Yeah, I drove myself here. Well, by all physical standards, you should be having a stroke and you should be having a seizure right now. You shouldn't be standing here laughing and having a good time with us. So this is the hustle culture, right? This is what it pushes us to do. And I don't know if you know anybody that's like this, Mike, but I know a lot of people that work 7 days a week in this industry. In fact, I don't know many that don't.
Absolutely. And you talked, there's a lot to sort of digest in your story. And it's so important to talk about these things and get them out there, because if you spend your whole day on social media, you'll see this hustle culture, and it can be really detrimental to your health. And like you mentioned there, you might not notice it right away, but all of a sudden one day you'll wake up and you'll have all these health problems that you talked about there. Let's talk a little bit about that, because that hustle culture is good for some in the short term, but then you put so much stress on yourself, and then something like real life hits you. Like you mentioned, your father passed away, and that can be extremely a stressful situation when you have to keep up with your business. Maybe you stretch yourself a little bit too thin, and now like real life comes into play and it hits you like a ton of bricks. How do you get past something like that when you are an entrepreneur?
Well, I mean, unfortunately for us, you just have to get past it, right? But there is people out there that can help you, right? You know, when you lose somebody, you're going to go through depression, anxiety. Everybody's going to deal with it differently, but most of us just internalize it. And as business owners, we really just push harder because that's all we know how to do. But there's people out there that can help you. There's crisis lines, there's Ontario health lines, there's therapists, there's psychotherapists. Go see your doctor, right? And ask him, tell him what you're going through, and they can lead you to the right direction. Reach out to your family, even a friend, you know, or somebody outside of the whole circle. For me, I didn't reach out for that help. It wasn't until this year that I actually reached out for help. And it took me a long time to realize that I needed some sort of person to talk to about all these issues, right? And that's the second part of the story we'll get to. But this is what people can do. You can stop for a second, because the day that I found my father passed away, I actually went out and I continued because I had no idea what to do. I actually continued. I did more quotes. That's not right, but that's all I knew, right? That was literally my entire life, and the hustle culture had engulfed me to that point. And the next day I sat down and I said, crap, I don't know what else to do. I can't do anything else. Where do I go? What do I do? This, that, and the other. And as many people came at me and said, hey, Jay, you know, here's somebody to talk to. My cousin works for the DRPS, and she handed me a number one day for the crisis hotline. And I took it, I crumpled it up, I threw it in the car, and I continued on about my life. That was the wrong thing to do, right? You really got to stop for a second, Mike. You really got to take a look at what's going on around you, and you really have to understand what's best in that moment. And it's not necessarily going to be your company. Your company is going to survive. You need to take 2 weeks, maybe 4 weeks, whatever you feel you need. Your company is still going to be there, and the employees you have set up are still going to be there, right? And the loyalty that they have to you and you have to them is really going to show in that instance, right? And you may go through some issues, right? You may not have the best employees, but you know what? That's great, because now you know times are tough and you need to lean on them like they've lent on you. Perfect. They're not the right employee. You can go into a proper way now of going forward, right? But it really does start with reaching out to somebody. Don't just put your head down and work. Take some time for yourself to grieve or to do whatever you need to do. Me, I found race car driving is super fun, gets a lot of steam out of me, and is a positive way to get going. So go out to the track, have some fun, maybe get in a go-kart, whatever. But don't just fall into work, because that's what I did.
Yeah, it's so important to have a hobby outside of your passion that you put into a job or to start a business. You know, hopefully you're passionate about your business when you start it, but to also have a hobby outside of that isn't reliant on you earning an income from it. It's just a release, and that's so important in my life as well. But also, you talked about reaching out to somebody, talking to somebody. We're going to get into this a little bit later in the interview, but what is it about talking to somebody else, whether it's somebody that might be in the same shoes as you or that hotline that you talked about? What is it about talking to somebody else that helped you kind of overcome this anxiety?
Well, basically just that it's normal, that it's a basic normal response of the body, of the mind, to the stressors that are going on. It's this situation has pulled you outside of your comfort zone, so to speak, and you don't necessarily know how to deal with it because you never have. And that's okay. That's really okay. You're not any different than anybody else. Most people are going to go through this. There's numbers out there that show this, right? But when I was talking to this person, It was basically just a simple understanding that, you know what, here's somebody I can tell everything to. I don't have to worry about being vulnerable. I don't have to worry about being the tough guy. I don't have to worry about the fact that I have feelings about this, right? And that the next day I can still go out and work, and I can be that tough guy, and I can be the leader for my team, and I can be who I think I am, who I've made this big bubble of who I am, right? But that it's okay to have, I guess, kind of like a duality, I think is what you would call it. You know, you're allowed to be strong on one side. You're allowed to be tough as nails, but you're also allowed to be vulnerable, because that's also part of you, right? And when you don't have a good combination of the both of them in between you, and when you just hustle, you're eventually going to hit that roadblock, and it's going to hit you hard. And it may not be in your 30s, it may not be in your 40s, but it's definitely going to be in your 50s. And that's where you start to see a lot of people really get serious health issues, and they can't get past them, right? I myself, I've had one mentor, a beautiful man. He taught me a lot about the maintenance industry, and he passed away early at the age of 56. And that's because all he did was hustle, and he never kept in check his health. And that was life for him. That was the end, right? So if we don't stop and recognize these things now in our 30s, in our early 40s, once we get to our 50s, it's really going to be extremely bad, because you can't reverse it then, is what I'm trying to say. But for me, I guess it really was just somebody saying, you know what, it's okay. This is normal. There's nothing wrong with what you're going through, but let's go through it.
Yeah, absolutely. And it's this balancing act is what I'm hearing from you of, a hustle is not bad. It's just, you need to balance it with taking a step back and taking a breath.
100%. And the other thing too, this person that I speak with, she said to me, you got to go through the motions. It's just like, going to a job. You can't start at the end, can you? No, absolutely not. You got to start at the grueling beginning, right? Let's talk with the customer. Let's get this design out there. Let's get a quote that works for them. Okay, we sold that. That's great. Now you got to produce the product. Now we got to dig it. Now we got to battle the rain, the sun, the snow, whatever we're dealing with. And then we can get to that finished product, right? So if you don't go through all of those motions, if you literally just skip to the end every single time, it's going to build up, and it's not going to be good, man.
Now, you also mentioned health issues that came into play in your story. Was this something that you woke up one day and you realized that you might have had this pain, or were there signs along the way, including with your weight gain that you talked about? Were there signs along the way that there is a problem brewing within you and it's going to come to a head, but you just had to keep on pushing forward? Or did you just wake up one day and it was there?
No, 100%. There was signs along the way. I remember cutting some aluminum rail with a hacksaw of all things, because I couldn't get electrical in the plug out front of this house. And I literally started to faint while I was doing this, right? And I said, man, I just don't feel good. Wow, it's 32 degrees out. I'm in the sun. Maybe that's all it is, right? Or, I'm tired every single day. Why am I tired every single day? Well, because maybe it's just because I go to bed at midnight and I'm up at 6 a.m. or at 5:30. Maybe that's all it is, right? There's these little signs, these little indicators that were there the entire time. And then also, I work 7 days a week. Why can't I lose weight? Like what's going on here with my body? I don't eat horribly, but I can't lose the weight. And stress and anxiety will actually cause you to keep weight on, right? And inherently that weight will cause other issues inside of your health. So there was definitely some of those things going on. And, at another point, at a latter point, a year later after I had this diagnosis that I had this issue, and, to furthermore that story, I had to go into surgery. All right. So I had to have what's called an afundoplication and hiatus hernia repair, and also a gastric reduction as well. So about a year later after that, because I had never actually gone in and followed the signs, I got insomnia. So I couldn't sleep. right? And I noticed that building up for the longest time, but Mike, I never actually went and got the help. I never talked to a doctor. I can't sleep. Is there something I can do? All these signs were there, and it just built up to a head.
It's good to recognize those signs and get help before, what do they say? An ounce of prevention is worth a pound of cure, something like that. And it seems vital in terms of your mental health. Now, continuing on with your story, Jason, is there anything else that has occurred since then that you'd want to talk about, or where you're at today?
Yeah, absolutely. Just before I reached out to you, Mike, and I started listening to podcasts, thank you for the value. It's pretty cool to keep us going and inspired. Just before I had reached out, about 2 to 3 weeks before, I was admitted to the hospital. I had 2 strokes, right? And I was healthy. I was going to the gym, Mike. I was going to the gym 4 days a week. I would work out for an hour and a half, eating right, doing everything I needed to do properly, but I was still hustling like there was no tomorrow. I was doing more work than my guys were. We're a snowplow company in the winter, and I would go out and I would stay up for 24, 30 hours, and that's a normal thing in our industry. We shouldn't be doing that, but that's kind of what you have to do, right? And it came to the point where I was driving in a skid steer, and I started to get weak, and I felt all the signs and symptoms. Thankfully, a buddy of mine called me at the same time as all that was happening and helped me walk through it. I ended up in the hospital for 4 days, right? I'm fully recovered now. I have no issues. And as of last Thursday, I was cleared by the neurologist to go 100% back to work. But should I be going 100% back to work? How am I going to do that now? Where am I actually going to put myself in this situation of my business now, right? Because everything I've done up until this point, up until about a month and a half, 2 months ago, has put me back in the hot seat of a physical issue, right? Now, before that, I'll go backwards again. About a month before that, I ran into a lot of stress, and I seen this COVID-19 thing coming. I had a lot of personal things going on in my life, and I ended up one day, and this is very hard to tell people, but I ended up one day on the floor having a panic attack. Now, I couldn't control it. I couldn't do anything about it. I had no idea what it was. I couldn't speak, yada, yada, yada. It's a very weird thing, and thankfully I've only had it once in my life. At that point in time, Mike, after all of this stuff that I've told you, after the past 5 years of loss, of grief, of physical issues, of anxiety, depression, all these things I was going through and just hustling, that's when I actually made the decision to go out and talk with somebody. And it's been 2 months since I've started talking with that person, and my anxiety is gone. There's no depression. My health is 100% better, and I'm able to tell people my story and give advice on where they should be going if they're interested in going that direction.
And Jason, thanks for sharing your story, because it's so important to get this message out there so that other people in the same situation understand that it's not abnormal, that they're going through something that is common and can be common, especially for entrepreneurs. A couple things that you mentioned in there is your visits to the hospital. This can be really like a snowball effect, because a lot of stress can come from money. But if you're a business owner and you're in the hospital and you're not out there working, that means you're not making money, which means that's added stress through that all. And if you're in the States and listening to this and you don't have the proper insurance and you're actually having to pay for those hospital bills, that's even more stress. So I can see these health problems just causing increasing amounts of stress in your life, which can just, throw things for a loop, even worse than they already are. Jason, in terms of, reaching out with these troubles and talking to somebody, when do you notice it that you should, this is the time I need to reach out in order to prevent anything from happening in my health?
Well, to be honest, I would say the earlier the better, right? But we're all pretty stubborn men and women, and that's why we're entrepreneurs, because we can go out and we can work through anything that comes our way. but the earlier the better, right? So in my entire journey here in the past 2 months and the months before that, I've always looked at statistics. I like statistics because it's a factual information, right? So in your early 30s, if you run into these situations, you're 35% likely to get a mental health or physical health issue. Once you get to 35, that jumps up to 50%. Up to 40%. Once you get up to your 40s, that jumps up to 50. Once you get to 45, you're looking at more 60, 65%. And as soon as you hit your 50s, you're at about 80% likelihood that you're going to get a mental health issue that's going to lead into a physical issue that will lead into either an abuse, substance, alcoholism issue. And if you don't get it, like what I'm saying earlier, the longer you let it go, the harder it's going to be to get to. So if you recognize that, you don't want to get out of bed in the morning, just tell somebody that. Reach out to somebody. If you realize that when the phone rings, your heart starts to race and you don't have that same vigor to go after that job anymore, just tell somebody. Get out there and get some help. If you realize that you're tired all the freaking time, it's not because you're hustling. Your body can handle it. You're a human. You can go. It's because there's something wrong in the background, right? So don't just suffer in silence, and start early is my message to people.
And I'd even go a step further. And even if you aren't experiencing these things, reach out to other entrepreneurs, other people in your shoes, other landscapers, and get networked, get talking to people, even if there isn't a problem, because when a problem does occur, at least you already have that foundation that you can reach out to and work to solve those issues, those mental health issues, those problems in your business, whatever it may be. And Jason, I know that you've taken it upon yourself to start something. Can you talk a little bit about that, something that you've started to put together?
So I've talked with a couple contractors, and what we're looking at doing is basically just saying to people, you know what, whether you're young in the industry or old in the industry, if you need some advice, if something's going on that you can't handle, if you just need somebody to give you a better outlook, or even just, you know what, I don't know what to do, I don't know where to go, and I don't know who to talk to. We're looking at starting, and it's very in its infancy, but we're looking at starting a network of people, of contractors that have the experience, are in the right position, and are able to take, maybe 2-3 hours out of a week to help a young, just fresh person into our industry, or somebody who's hit a roadblock and doesn't know how to take that next step, right? We've kind of coined it as the reality check program, right? And it's in its infancy, but I found that throughout my process, anytime somebody had given me some advice, that anytime somebody had said, you had priced this too low, or Jason, it's not really that bad, just take a step back and look at it, you can get to the next step, don't worry about it. That's really helped me, right? And one person that I talked to, I'm not going to mention his name, but I talked to this guy, and he's a really good guy. He had a young guy that actually asked him last year, I don't know what to do, I'm starting out, this, that, and the other, and this is a perfect example of how this can help somebody. This guy went to the job site and he said, you know what, this is how you're going to do it. This is how I would suggest you price it, and you can do it. Good luck, right? Well, now we're in this whole COVID-19 thing, and this same person reached out and he says, I can't pay my bills. I can't do this. I can't do that. Well, let's step back a second. You have a $300 trailer payment. You have a $500 truck payment. You know what? If it's really going to break your bank, just let us help you with that until this is all said and done, and let's get to the other side. All this kid really needed was a reality check, right? And that probably stopped him right there from getting into alcoholism, or stopping being an entrepreneur altogether, or just hiding in his room and not knowing what the hell to do, right? So this is kind of what we're hoping this program will help people to see, is that, you know what, we all go through this. We all start out a certain way, and some of us make it better than others, but we can all make it, and we can make it together a lot easier than we can separate. So if you have an issue, just reach out and we can help you the best we can. We can't promise anything, but we can definitely be there in a small fashion or a big fashion, however that may be.
And so important. And Jason, is this going to be like sort of virtual meetings and discussions? Are you trying to focus on more local? What can we look forward to with this?
Well, I think it's best that, for me, talking with somebody in the United States, it's a lot different to Hardscape in the States than it is up here. So if there's somebody in that person's local area or in that state per se, like, hey, I suggest you reach out to this guy. They'll get back to you when they can, and they'll be able to help you out, right? It's just kind of like an entrepreneur helping hand type thing. And I think it's important that you really have somebody in your area as well, so that way they can really speak to what you're going through in that state, right? Because here in Ontario, the way we build, the way we do things is completely different than the tip of Florida, right? Mm-hmm. We've all taken those ICPI courses and we know the differences, but also the pricing is different. The people are different. The ability of laborers are different, all sorts of things, right? So, and also, I mean, if somebody needs a site visit, we can't really just pick up and drive to Michigan, can we? So I'm hoping that people who are listening to this will see value in it if they can help and reach out. And you can reach out through my Instagram. It's the easiest way to get a hold of me. And I'm hoping to build this network of professionals that can help people in geographic areas.
Perfect. And Jason, what is your Instagram so that everybody can know where to go?
That is at Trilli 2010, TRILLI 2010.
Perfect. And any other website or anywhere that you can direct them if they want to go to see it?
Well, we're also at www.trilliumlandscapegroup.ca, and we're also on Facebook as well, Trillium Landscape Group and Trillium Maintenance Inc.
Perfect. And Jason, just rounding out this interview, do you have anything else that you want to sort of get off your chest or let anyone know out there that they're not alone in this, especially as an entrepreneur? Any other points that you want to leave us with?
You're not alone. I mean, to go through this construction industry, this is hard. This is one of the hardest industries you're ever going to be in. And it's also one of the most rewarding industries, both financially and mentally as well. You get a lot of great things from this industry, but it is hard. And you're not alone in it. There is people to reach out to. There is people who are willing to help. And if you just start DMing somebody, and if you just start picking up a phone, if you go to, for us, a Landscape Ontario meeting and you don't belong, just go. And there's going to be people there who you can meet and who will shake your hand and give you advice. There is programs out there as well. Let's just say, you find yourself depressed. There is numbers you can go to, Ontario Telehealth. You can go to the youth telehealth, and you can also now reach out for free advice and therapy in Ontario as well through telehealth, right? But in our industry, just don't be shy. Pick up the phone, start talking. And this is how relationships are made. And you're going to find that we really can help each other, because, Mike, there's more work out there than we know what to do with at this point, right? There's more work than there is skilled laborers and skilled companies. So me and my friends, we take the approach of, let's help each other out. Let's let these people reach out, and let's reach out to each other. And that, in this time that we're dealing with right now with the whole pandemic, with the shutdowns, all that kind of stuff, I think this is where it's going to be more important than ever to actually band together and help each other and take our industry to the next step.
Yeah, and just going off what you said there, I really see with the future of this industry that as more people are not getting into being laborers, getting into this type of industry, our stock is only going to go up, and that means there's going to be so much work for everybody. And you see it on these social media networks and this community that's being built between everybody, and everybody wants to help out and lift each other up rather than seeing each other as competition. So it's great to see this in the future of the industry. And just going off what you're saying, again, mental health is so important, and this is a perfect interview to have, and a very timely one with what's going on in the world right now and all this uncertainty. So Chasin, thank you so much for reaching out to us and talking with us about your story on today's episode. Thank you for listening to today's podcast episode. If you want to dive into the How to Hardscape Headquarters software, start putting those courses together for your own business to document safety training videos or anything you want, or you just want to hop into a budgeting, estimating, job costing, time tracking, scheduling, CRM, all these different features that we have available right now in the software, send me a message at How to Hardscape on Instagram, or go to hthheadquarters.com and you can book a demo with me right there. We want to say thank you to our sponsor, Cycle CPA. If you're looking for bookkeeping, accounting, CFO services, reach out to Cycle CPA at cyclecpa.com. Let them know How to Hardscape sent you for money off their services there. And we look forward to meeting with you next week on the How to Hardscape podcast.